questions. So what we've been calling this a uniform data set, or Step Up and Be Counted, it's now being called the National School Nurse Data Set. I've also made an assumption that you've all read some of the literature, or that you really get why we're collecting data. If you're like me, maybe you come to this kicking and screaming, but a few of you will be leading the charge and really getting into the reporting of data. I'm leading the charge not because I necessarily want to or like it, but because I really believe in it. I've been fortunate enough to see on some of the early stages of the development of this project the integrity of the people involved, and just have a real ultimate trust in their rationale and capacity for moving this forward. So I really wholeheartedly support it. There's kind of three ways to look at the data for Vermont in this webinar, and one is I could give you all the background of how we got this far, or I could just give you the conceptual information on the data points, or I could look at the actual logistics and the details in the weeds of entering the data. This webinar really is going to focus on the conceptual information so that everyone in Vermont is on the same page. But for those of you who don't understand or have more questions, please write them down and send them to me in the chat or later. This is a huge project across the nation, which means it takes a lot of people doing many little pieces. It is evolving and developing. It means there's a lot of things that might be changing a little bit as the project matures over time. The name change is just part of that maturation process. I do ask for your patience and understanding, as you've already experienced a recent email change. There will be some technology learning curves for all of us. The good news is the actual reporting of data for you in your SU is that it's pretty tried and true, and that path should be pretty simple. I'm hoping that you'll all choose one nurse to kind of lead the project in your district, ideally, so that one nurse would report data to me. The final school nurse database, the National School Nurse Database, is really set to kind of be completed by 2018. If we don't measure it, we aren't doing it. If we are doing it, let's measure the impact that it has on student outcomes. So moving to the next slide, those folks that are really in the trenches with this at the national level are kind of calling it, in their little secret world, the hummingbird projects, because they're working so very hard to get lots of little tiny pieces done for just little bits of sweet success and no pay. There's no money for the nursing time on any of this, so this is all volunteer work for all of us. There's a little bit of grant money given to NASN and the National Association of State School Nurse Consultants to work on some of the infrastructure that supports the work, but the leaders are all donating their time. Let's see. So next, I need to say thank you to the people that are doing this work. And the first thanks goes to Clayton. Many of you will see his handprints and technology prints in lots of different places, but as a school nurse in Waitsfield Elementary, he's donating his time to be the school nurse technology expert for VSSNA and providing the technology support for this webinar. You'll see he set up a new email, datachamp@vssna.org, through the VSSNA Google account. So until some fairy godmother parent comes along and gives money for this whole project, it will continue to be voluntary through VSSNA and other state organizations. At the end of the webinar, I will share the PowerPoint with you. And I also want to thank the folks on the national level for the vision to advocate and organize these steps for all of this work. So at the end of the webinar, I hope you'll be able to, describe about three reasons for the National Uniform Data Set for school nursing, what information that you would be providing. Of course, it's all non-patient, non-student specific, and that you would understand why guesses don't count. There's 3 ways to submit data, and to know when to report the data for this year and when to report in the coming years what Vermont's schedule will be. I'd like you to read this. I'm not going to read it. Again, at any time in the chat box, just write in questions. I hope to finish the talking by 4:45 or before, so we'll have time for questions. I think we all know we don't do this data thing for our health or for money, but we do it because it advocates for the needs of students. We know what students need, and more students need us more now than ever before. We know this, but it's also our ethical responsibility to speak up for what students need, and this is a way to do that. You've been hearing, some of you hear me say that school nurses are going to save the world, but we have to be able to explain that sentiment in language of parents, school administrators, school board members, and taxpayers of how we help students stay healthy and stay in school. So the data will help us do that. That our quality school nurses being in school benefits the student with increased attendance, seat time, access to health care, management of chronic disease, and prevention of long-term disability, to name a few. It benefits the school from having quality school nursing by increased time for teachers and for administrators to teach and do their work, and it lowers the cost of substitute teachers if we keep the kids and the staff healthy. It benefits communities in ways that we don't really talk about, but for example, H1N1, the public health preparation, there was a lot of work that, and pertussis, we protected the public in a lot of ways. Ann Sheets and her colleagues in the 2014 Health Impact Study demonstrated that every dollar spent on school nurses saves $2.40 to the healthcare community, just to name a few benefits for why we're doing this. So getting right to the data, what you see on the left is information that was reported last year, the number of students enrolled in the district, and that, of course, is the October enrollment date. FTEs for RNs, LPNs, and health aides, FTEs for floating RNs, and FTEs for special assignment RNs. And then in later, the second, with that report would be the chronic health conditions, asthma, type 1 diabetes, type 2 diabetes, seizure disorders, and life-threatening allergies. We're still on the left side of the list. And the dispositions for last year, the only dispositions, meaning, the nurse sees the student and the student goes back to class, goes home, goes to the doctors, goes to the ED. That was last year's data. The addition for this year is what we just talked about, but the addition is reporting the work of any LPNs. And when I talk about LPNs, please remember that this is a data set for the nation, and there are some states, Texas is a good example, where many of the nurses are LPNs or LVNs. So we're trying to capture the whole workforce. So special assignments are for people that are, working maybe in a special classroom, maybe working with special students. I hope you can see my cursor. So I'm pointing to the health aides. So to report an FTE for a health aide, if you have a health aide that works for you, some of us dream of this, 0.2, maybe a half a day a week to enter data, or even 2 hours a week to enter data, that's designated time for health services. That would be reportable. If you have a secretary who covers for you on the 3 days you're not there, unless that secretary's sole job is to do health services, that person would not be counted. So let me know if you have questions on that. So this year they added, so if there is a nurse leader who maybe works direct service for part of the time and then maybe does administrative work for 2 days a week, that FTE would be reported as those 2 days a week, or I guess that's about 0.4. And then administrative support, again, that would be like clerical support or somebody who supports designated time in their job description for supporting health office services. And then the one at the bottom, so obviously the health conditions would be the same as reporting this year. And then additionally, last year, the disposition was only from students seeing an RN. This year, it would be additionally nurses who saw the LPN, either instead of, or I guess, yeah, instead of the nurse. So what I just described is what at the local level, at your school, individual school levels, you would report. And I know this says K-12, and I'm pretty sure that this is only K-12. We are not talking about pre-K because it's not a national standard yet. So that information we just described on the data page would be information you would collect from your school, and then you would report it. Ideally, I'm hoping those of you in bigger districts will choose one nurse to collect all that data and put it on one page, and then that information would be sent to me. Kind of going back again, this is just a visual picture of what we just talked about. The RN with a caseload time, and then LPN, direct service, health aides that provide regular health services, so their designated work job description relates to health services. I don't really have to tell you about chronic health conditions. This is just the rationale for why it's so important to report health conditions. There's hundreds of health conditions, and in the process of developing this project, they have chosen the big four, and that's where the asthma, the serious allergies, the seizures, and diabetes. I think diabetes was broken into those two categories because when this project started, there was federal dollars specifically to address obesity and type 2 diabetes from CDC, and that's, you know, it's not gone, but it's less of a focus. But so there's the big four. It's a visual of that. So you would be reporting in your district the number of students with asthma. These are students who have a diagnosis from a physician or medical provider. So if there is no real documentation, you don't have an asthma plan, for example, or a medication order for a student with reactive airway, you wouldn't count that student. That pretty much would be the same number you would report to the health department in your annual school nurse report. And some of you may or may not know if you have students. I didn't always know if I had students with type 2 diabetes. And of course, no personally identifiable information is shared. I'm not going to get into this a whole lot, but just read the green up here. School nurses provide each student with equal opportunity for educational success in a safe environment by promoting the student's well-being by many means, and hopefully the data set by 2018 will fully describe that role with data points that make sense. So I'm going to back up once. All of the data that we talked about in terms of the FTEs, the student enrollment count, and the chronic health conditions, those would be reported hopefully as soon as you can. I'm going to say by June 1st, ideally. Then we're going to move to this next part. This is that health office dispositions, and we would need to be looking at that data the last day of school. That's a really busy time, obviously, so you would try to look at your calendar and figure out when you might be able to best report that. If I could have it by July 1st, that would be good. I will really need your name and phone number and an email for contact over the summer. Once I get the information, I got to make sure it's correct. So to back up a little bit, the FTEs, the health conditions, student enrollment, and this health office disposition information, the individual school nurses from individual schools would report this to the lead nurse in your SU. And the lead nurse would then ideally report it to me. That would be the state level data. So I would get the information from hopefully all 60 supervisory unions, where we actually are looking good as far as really increasing the numbers of people who reported previously. So I'm excited about that. Send only the data that's recorded, So if you have a secretary who receives students but only records the medications, then there's no data there to report. Besides, we're not even counting information from the secretary. If you have, let's say you're, let's say you have counted for some reason your screening information as an encounter. If it ends up in your encounters for disposition and those kids went back to school, those numbers would come through to me. But if you have nursing interventions that you haven't recorded and we can't prove that they occurred, then you wouldn't have data to send. So submit your information from the October enrollment, the number of students with chronic health conditions, and the FTEs. Back up to the chronic health conditions. So you're going to have some students with 3 chronic health conditions. Maybe the student has diabetes, asthma, and a food allergy. So that student is going to show up 3 different times. So you're counting the health conditions, you're not counting the student. And then the last data point, that last disposition data point would be reported after the last day of school. So this year, the plan is for as many of you to submit the data on FTEs and chronic conditions by June 1st, and the last day of school will be the disposition data. In talking with the VSSNA, the board of directors, from future years, we'll be using the January 1st date for FTEs and chronic health conditions and the student enrollment data. But obviously we missed that date this year as we're moving this project forward. So what ways can you report? This link I made the other day. They've already updated it. So don't use this link, but it clicks on the Excel spreadsheet, or excuse me, it clicks on the list of data points. So you could click on, I'll show you the NASN website in a minute, but you could print off that document and fill it in and send it to me manually, or scan it and send it to me electronically. Excuse me. The individual school nurses would be sending it to the lead nurse, ideally. If you don't have a lead nurse and only 3 nurses or 3 schools out of the SU are reporting, that's okay. Then report directly to me. You can do it manually. You can use that spreadsheet and report that to me. The lead nurses will use Qualtrics. So they'll have collated all of the information from the nurses in the schools in their SU, and that would go into the Qualtrics link that I will send you. The NASN, that all goes back to NASN. NASN will hold it, and at some point I'll say, okay, all schools in Vermont who say they are going to report have done so. We'll close the link, and they'll send it back to me, and then I collate all of the SUs and clean up the data and make sure it makes sense. And then I submit the state report finally, and I have from June 1st until October 31st to clean up that data and report it back to NASN as one single state report. So looking ahead, again, just to repeat, so for the 2016-2017 school year, we'll be asking that you, I say we, so the VSSNA Board of Directors is supporting this effort. We've all agreed that January 1st kind of falls in line with everyone's thinking of, okay, we're collecting data, we're making these reports, so let's kind of do it all at once. So next year will be January 1st, and then the last day of school again would be the disposition data. I feel like I've moved along pretty quickly, which gives more time for questions and answers, and maybe we can get done sooner. But again, the rationale for the data set is that we have to advocate for our students. I've talked about the data to submit. Guesses don't count. So if you think you have 13 students with type 2 diabetes in your supervisory union of 2,000 students, that don't report it. If you don't have the data, just don't report it. If you have, the 6 students perhaps with type 1 diabetes, and you have the number of students with asthma and life-threatening allergies and seizures, and you're confident of that data, report what you have. And that way we can be confident that the data across the country is robust. And then there's the 3 ways to submit the data, and then I shared the dates. And again, for this school year, if you can report to me as close to June 1st, your October enrollment count number, your number of students with chronic health conditions. Now I know that the number of students with chronic health conditions today or June is not likely to be the same exact number of, for example, asthma that you reported in January, because 5 of those kids moved out of the district and 10 more moved in and had different health conditions. Don't worry about that. Just report what you have in the month of June for the chronic health conditions. So I'm showing you the email that I've been using to communicate with everyone, the sharonlee.sfx.edu@gmail.com. I will transition away from that and use the VSSNA account, datachamp@vssna.org. Please feel free to call me at home or on my cell phone at any time if you have questions about that. I will send you, after this is over, the link to this. We can talk about this data if you want, this sheet, and there's a few other pages of it during the question and answer. So I'll send you the link to this. I will send you the nurse leaders. I will send the link to the Qualtrics link. If you don't have a nurse leader and there's 3 different nurses in one district reporting, I can send you the Qualtrics link. Let's see. I will send you the PowerPoint. And Clayton has been working hard on this, and he's hoping that he was able to record this. So I'm doing this today, and I'm doing it tomorrow. I'll get to choose, hopefully, which recording is better. I'm not sure yet if Clayton's able to do both today and tomorrow, but thank you for what you can do. And that, I think, is the end. Go ahead. Oh. I heard a funny sound.
Shoot.
Should I go?
Sharon Lee, can you hear me?
I can hear you now.
Okay,
yep.
yeah, so...
and I see a couple other nurses. Just, Clayton, before you go further, I'm going to ask the others that joined since we started to actually turn off their camera and turn off your speaker and use in the upper left-hand corner the chat box to send in your questions. Okay, Clayton, go ahead.
I was just going to say, one of the questions that popped up was, what was the information? Aaron wrote, what's the information you need by June 1st? Could you just go over that again? What specific stuff you want for June 1st versus the end of the year?
For June 1st, please send me your October enrollment number, your FTEs of the nurses, and your